Darrell Montroupe says his role as Permanent Secretary in the Ministry of Health is to administer that ministry run by Dr. Keith Mondesi. The minister devises policy, his PS executes, and along the way advises on the best course forward. And although the minister is not obligated to listen, Montroupe is obligated to provide guidance. On the issue of integrating the mental and general hospital, Montroupe says this procedure was not followed.
Was there a discussion between the two of us on that? No, I don't think so.
What may be surprising, given the admitted contentious relationship that exists between the two men, is the PS's support for the new plan. Unlike the majority of respondents in a recent e-poll who do not support it, Montroupe says it is a sensible one that would allow for maximum use of resources.
Integrating the services, the two facilities, you will have some reduction in some costs. Because, for example, you may be able to share laundry facilities, you may be able to share your kitchen facilities, you're able to share some of your backup electricals and water supplies and security systems, etc. So there is some merit in integrating services.
The support also comes with a reality check. Montroupe says the current mental health system is not ready for a 40-bed mental facility. He says St. Lucia may not get there for another 6 to 10 years. For this reduced bed count to work, the community program to be launched this month must be in full operation. There must also be beds for the mentally ill at area hospitals.
St. Jude's Hospital, as an example, would have provisioning for mental health services. So St. Jude's would have created at least a 10-bed space, allocated 10 beds in the facility for psychiatric or mental health patients. The new general hospital would have had between 10 and 20 beds to deal with mental illness. So down that road, we could see us discharging more patients into the communities. They could be managed through a primary care setting or context. And the numbers, the 104 bed, can then be shrunk to a more manageable number, whether that number ranges between 40 and 60.
The new hospital will be completed by the Taiwanese government. It is expected to take 10 months from start of work to completion. Carmi Joseph, HTS News, Channel 4.